Then Doppler. So each and everything in the Doppler section is super important for the SPI. Why? Because it is the 33% of the exam. So every concept should be on your fingertips. Like we will start from the Doppler effect basics. So what is the Doppler effect itself? It is change in the reflected frequency. So if reflected frequency is high, it's positive Doppler shift. If it's low, it's negative Doppler shift. Then how to calculate Doppler shift? FD is equal to receive minus transmit. And then you must know it's audible. The pulse and echo, it is not audible, it is ultrasound measured in megahertz, but the Doppler shift is audible. We can listen the sound when we turn on pulse Doppler. We can listen the sound. How? Because it is audible. And how it become audible? Because it's receive minus transmit. It's a change in frequency. So what will be the unit of the Doppler shift?
Kilohertz.
Yes, because it is in the audible range. Then the Doppler equation. FD is equal to 2FTV cos theta divided by C. Very much important. Like Doppler shift directly related to transmit frequency, velocity of the blood, and inversely related to the angle, and speed of sound is just a constant. So these parameters very important to understand all of the concepts and also for the exam. Then you must know what is creating noise in the Doppler and how to differentiate between actual signal and the noise, and then use of the Doppler. And then you also know about color Doppler. It's super important. First of all, it's instrumentation. Main instrumentation is color box, color map. So color box. When the color box is big, frame rate reduces. Color box small, frame rate increases. Then you must understand the color map, because it's like a GPS which guides you. So in color map there is a baseline in the center, above channel is positive, below channel is negative, and when you press invert button, what happens? Reversal of the color, not reversal of the channel. Positive always above, negative always below. And what it shows? Velocity scale, velocity range which we can measure, and the maximum value of velocity scale is the Nyquist limit. And the lighter shades, they show high velocity, and the darker shades represent slow velocity. And then there is also a variance map. In variance map there is green color. It highlights the turbulence used in ASD, VSD. And what happens in aliasing? Super important. And it's very simple. What happens in aliasing? Blood velocity becomes very high. So Doppler shift is very high because Doppler shift is directly related to the blood velocity. And like our system ability to measure it reduces. Now what is our system ability? That is our scale, that is our Nyquist limit, that is our PRF. These three things. So all of these things reduces when aliasing happens? Scale, Nyquist limit, PRF reduces in aliasing. So what to do to correct aliasing?
You increase the Nyquist limit.
And scale?
And scale.
Increase or decrease scale?
You decrease scale so that the Nyquist limit will increase.
Okay, what about PRF?
You decrease PRF.
What was the cause of aliasing?
Because the Doppler shift is greater than the Nyquist limit.
I told our system ability is defined by three things. Nyquist limit depends on PRF. Nyquist limit is equal to PRF divided by 2. And Nyquist limit is the maximum value of the scale. So these three things are directly related. What was the cause? These things were low. All these three things. Low. Low Nyquist limit, low PRF, low scale. And what you do to correct aliasing? Increase all these three because they are directly related. So this is one of the method to correct aliasing. What else you can do? You can reduce the Doppler shift because the cause was increased Doppler shift. Now you can do to correct aliasing is to reduce Doppler shift. So how we know how we can reduce Doppler shift? So answer is Doppler equation. So Doppler shift is directly related with the transmit frequency. When we have to decrease Doppler shift, what we do with transmit frequency? Increase or decrease? Decrease transmit frequency to decrease Doppler shift. And increase angle to decrease Doppler shift. Although we don't want to increase angle because when we increase angle, our error in measurement increases. So it's the least preferred method, but according to physics. Because angle and Doppler shift inversely related, so when we want to decrease Doppler shift, we have to increase the angle, but there is a limit. In Doppler, our angle should be less than 90 degree. What else you can do is to change the depth. So to correct aliasing, we will increase the depth or decrease the depth.
You will increase the depth.
When I will increase the depth, there will be low pulse repetition frequency. Pulses will take more time to go and come back. And low PRF, a cause of aliasing, I want high PRF to reduce aliasing. So what I do? Decrease the depth. Because in superficial structures, PRF become high. So when PRF become high, aliasing is reduced. And then if there is a very high velocity blood flow and we want to measure it without aliasing, then we can simply switch to CW Doppler. So all these points are super important related to aliasing. All of them, not one, everything. Then there is packet size, very important. Packet size, another name is ensemble length. It is the number of pulses transmitted per scan line. So first you have to understand what is the packet size, what is its other name, that is ensemble length, then its definition, number of pulses transmitted per scan line, and then what is the effect if the packet size is high and if the packet size is low. So when the packet size is high, so how it impacts the frame rate and velocity estimation, and when packet size is low, how it affects frame rate and velocity estimation. Then there is autocorrelation. So autocorrelation is a signal processing technique in color Doppler and power Doppler. How it works, and number of gates we use in each scan line, that is important. Also number of packet size, minimum number, maximum number. Minimum I think is 3, maximum is 32, average is 10. So you should also know about these things. Then what is the difference between aliasing and flow reversal? And also images of aliasing, how it appears on color Doppler, how it appears on the spectral Doppler, and aliasing is also known as wrap around artifact. Then you must know about the controls, primary controls and secondary controls of the color Doppler. What are the primary settings and what are the secondary settings, and how these settings affect further our Doppler image. Then there is pulse Doppler. So in pulse Doppler, first you have to understand its difference with CW Doppler. What are the benefits of CW Doppler over the pulse Doppler, and what are the benefits of pulse over CW? Like pulse has a good range resolution. It exactly tells where the signal is coming from. And what is the benefit of CW Doppler? There is no aliasing because there is no Nyquist limit. It can make a very high velocity without any aliasing. In pulse Doppler, there is a sample gate. And then sample gate itself is very important. Images. What is the correct positioning of the sample gate? It should be in the center of the vessel. It should not be close to the wall. Its size, it should be 1/3 of the vessel diameter. It should be in the center and it should not be very high. And what happens if you place it at a wrong location near the wall or very large? There is spectral broadening artifact. So you should also familiar about spectral broadening image on the spectral Doppler, and also image of normal positioning of sample volume. Then angle correction. What is the spectral display? Like what is on x-axis? Time. What is on the y-axis? There is velocity or the Doppler shift. What is displayed through z-axis? Amplitude. Then in sweep speed, which axis gets affected? Time. So x-axis. Then controls, again very important. There are primary controls, secondary controls. In primary controls, there is transducer selection, there is preset, there is depth setting, there is scale, there is simple volume position, there is baseline, measurement cursor, there is gain, so angle correction tool, and angle of the Doppler. So these are the primary controls. In secondary controls, there is a wall filter setting. Wall filter is very important. You must know what happens if the wall filter is too low. What happens if the wall filter is very high? There are images. What happens? If the wall filter is too low in arteries, there is wall thump artifact, and you must see the picture of the wall thump artifact. You must recognize that. And then what happens if the wall filter is too high? So diastolic flow will be missing. It will be cut off near the baseline. So you should also see the images. What happens if the wall filter becomes too high? And it should be off in veins, because in veins blood flow is already slow. Then there is transmit frequency. So you have to decrease transmit frequency when aliasing happens. It is in secondary control. Then there is sweep speed in secondary control and some other things. And also you must know about duplex and triplex. What is the difference between them? Duplex, B mode plus Doppler. Triplex, B mode plus color plus spectral Doppler. Also you must know about the amplitude. So amplitude, it is displayed in z-axis, and the gain setting changes the amplitude. You should also know about what happens when the gain is too low. What happens if the gain is too high? When gain is too high, there are background echoes. And also, like, primary secondary controls are very important for the color spectral both. Also in color Doppler, you should see the maximum images. What happens if the control is low, like the gain is low? What happens if the gain is high? What happens if the PRF is low? What happens if the PRF is high? You must see their images. So if color gain is too low, you will not see the blood flow. It will be missing. When color gain is too high, it will overwrite. There will be color bleeding artifact. It will be outside the vessel. What happens if the PRF or scale is too low, aliasing? What happens if the PRF or scale is too high? It will miss the actual flow. So, like in SPI exam, they will give you images maximum in Doppler. In color Doppler, in pulse wave Doppler, they will test you through the images. For example, color bleeding artifact image, and they can ask how to reduce it, or what is it, how to reduce it, what is the cause, are from going two images. One image is abnormal, like aliasing. One image is normal, no aliasing. So what you change from going A to B, from going aliasing to normal? What you change, like how to correct? Or they can ask like what is the cause of that? So they test you through images, mostly in the Doppler section. So your all concepts should be very, very clear. Okay, then in pulse wave Doppler, systole, diastole. When the magnitude is high and when the magnitude of Doppler shift is low. So it is high in systole because we can see the peak, and magnitude is displayed along y-axis, and magnitude is low in diastole. Then aliasing, super important section. Then there is duplex, triplex difference. CW and pulse wave Doppler difference is very important. Then there is power Doppler. So it is used to display very slow velocity flow. And there is no aliasing in power Doppler. It does not depend on Doppler shift. Unlike other Dopplers, it does not depend on Doppler shift. So it depends only on the amplitude or the strength of the signal. What are the uses, advantages, disadvantages of the power Doppler? It is very sensitive to slow flow. And in color Doppler, one other important point is in color Doppler, there is display of average Doppler shift. In pulse wave Doppler, there is display of the peak Doppler shift. And in power Doppler, you don't know about the direction, you don't know about the velocity information, you just have idea about presence or absence of the blood flow. And then there is Doppler contrast and artifact section. All artifacts are very important. The most important ones are the aliasing, color bleeding, wall clutter artifact, mirror artifact. All Doppler artifacts are very important. And then there is hemodynamic section. If your SPI exam is near and you have difficulty in these Doppler concepts, so I have a full session in which I have explained all of these topics. So here you can see lecture number 5, starting from the Doppler. Then there is for the Doppler shift explanation, a Doppler equation explanation, all of the factors, all of the important images and MCQs for the revision. Then there is color Doppler, color map, and all of other primary secondary controls, their significance, autocorrelation, packet size, how to use these controls, and how these controls affect Doppler image. Then there is information about how to find flow direction in color Doppler using the color map. And then there is pulse Doppler, concepts about aliasing. Then there are primary and secondary pulse Doppler controls, very important for the exam. Then there is artifacts explanation, also CW Doppler, power Doppler. So if you want to join our full session related to the Doppler and SPI physics, then you can contact us. I will share the contact details in the comment section.